In this course, we're going to focus on the first perspective, how speech sounds are produced. This is called articulatory phonetics. Articulate means roughly the same as pronounce. In order to understand how speech sounds are produced, we need to know about the different parts of our bodies that we use when we speak. We draw air into our lungs, which we then expel through our throat and out through the mouth, and sometimes the nose. On the way, we can use various bits and pieces to change the way that the air is moving, such as our larynx or voice box, our tongue, teeth and lips. All these different parts that go into making speech, the lungs, throat, mouth and nose, are collectively called the vocal tract. The larynx is the little lump on your throat. It's often called the Adam's apple, especially in men. Inside the larynx are the vocal folds. They are little folds of tissue that stretch across the throat, with a gap in the middle. The gap is called the glottis. We can move the vocal folds to make the gap bigger or smaller. When they are close together and air is being pushed up from the lungs, the folds start vibrating and making a sound. This is our voice. If the folds are far apart, the air can pass through without setting them vibrating. When we whisper, we keep the vocal folds far apart so there is no vibration. Some speech sounds are made with the vocal folds close together and vibrating. For example, M, B, V. They are called voiced sounds. Some speech sounds are made with the vocal folds far apart and not vibrating. For example, P, F, S. They are called voiceless sounds. If you put your fingers on your throat when you make a voice sound, for example V, you can feel the vocal cords vibrating. If you then make a voiceless sound, like F, you will notice that the vibration stops. When we speak, we don't just push air out through our larynx and our mouth. We use various parts of our mouth, such as our tongue, our teeth and our lips, to shape the sounds in different ways. The parts of the mouth that we bring together to make different sounds are called articulators. Typically, one articulator moves and makes contact with another articulator which doesn't move. For example, to make the th sound in 3, we bring our tongue up so that it touches our top front teeth. The tongue moves, the teeth don't move, but both are involved in making the sound. The articulator that moves is called the active articulator. The articulator that doesn't move is called the passive articulator. The passive articulators which don't move but have another articulator move to make contact with them are the top lip, the top front teeth, the alveolar ridge, which is the bony ridge behind the top front teeth. If you put your tongue against your teeth and slide it backwards a little, you can feel a ridge there. This is the alveolar ridge. The palate, which is the hard part of the roof of your mouth, behind the alveolar ridge. If you slide the tip of your tongue a little further backwards from the alveolar ridge, you can feel that there is a hard curved bit. That is the palate. The velum, which is the soft part right at the back of the roof of your mouth. You may be able to curl your tongue all the way back to where the palate ends and the velum starts. You should feel a soft bit right at the back where the hard part ends. There is also the uvula, which is the soft dangly bit hanging down right at the back of your mouth. and the pharynx, which is the part of the throat that is above the larynx. These are not used to make sounds in English, but they are used in many other languages. For example, the R sound in French is made by getting the uvula to vibrate. The active articulators include the bottom lip, the bottom front teeth, and the tongue. Because the tongue is extremely important in making speech sounds, and because we use different parts of it to make different sounds, it is useful to be able to refer to different parts of the tongue. The tip or apex, the blade, which is the part of the tongue that is just behind the tip, the front, which is the part that sits below the palate when your mouth is closed and your tongue is at rest, the back, which is the part that sits below the velum when your mouth is closed and your tongue is at rest, the root, which is the part that goes down into the throat,